सो ये मैंने क्या बोलते हैं उसको शेयर किया। 1 minute, हाँ, जस्ट 1 minute, हाँ, जस्ट थोड़ा आप wait करो। अनम्यूट। ठीक है, जस्ट मुझे बोल देना कि ये विजिबल है कि नहीं। So today we will do the orthopedic surgery. Okay. ज्यादा क्वेश्चंस आते नहीं है ऑर्थोपेडिक सर्जरी से, ओनली 1 or 2 क्वेश्चंस है। ठीक है, सो लेट्स स्टार्ट। आई एम ऑडिबल, राइट? आई एम ऑडिबल। एम आई ऑडिबल? यस सर, चलो ठीक है। सो लेट्स स्टार्ट विद द फर्स्ट। 1 minute। Okay, so let's start with the first question is about what do you mean by the Pott's disease? So Pott's disease in 2023 is tuberculosis of the spine, tuberculosis of the ribs, tuberculosis of the calcaneum, or the malignancy of the spine. Just tell me the answer in the chat box. Video বন্ধ করে রেখে। Okay. Yes, it is a tuberculosis of the spine. Okay, yes. The answer is a tuberculosis of the spine. So let's see what are the Pott's diseases. Okay. So first, they can ask you what is the most common site. Okay, so basically the spine is the most common site, and that also in the lumbar region T12 to L1. Okay, so this is about T12 to L1. Tuberculosis of the spine. Okay, the primary site is the GIT. So from the GIT, So from the hematogenous spread, okay, so the primary site will be the GIT or the lungs, okay, and from the blood, it's supplied. Just give me a few minutes. So the primary site is the GIT, TB or the lung, and via the blood, it goes into the bones, okay, and the first Most commonly joint affected will be the dorsolumbar joint, T12 to L1. Okay. So remember this, it can affect all the, like it can affect the, start with the synovial membrane, intra-articular bone, then affects the lamina, pedicles, but it does not affect the spinous process. Okay. So this is the most important, it does not affect the spinous process. Okay, so this is the diagram. Okay, baki yaad rakhna, it's affect the lamina, transverse, okay, pedicles, but it does not affect the spinous process. It spreads via the Batson venous plexus. So from the GIT tract, okay, from the GIT tract, it spread via the which communication, that is a Batson venous plexus. So they are the four types: paradoxical type, central, anterior, and the appendiceal lesions. Okay. Among this, paradoxical lesion is the most common one. Okay. So this can be one of the questions. What is the most common one for the POTS disease? Most common involvement, that is in the paradoxical lesion with the reduction in the joint space. Okay. With the reduction in the joint space. Okay. So these are the four types. Okay. And one thing you will know, if they ask you what is the most common sign and symptoms of the TB of the spine or the POTS disease or the tubercular spondylitis, your answer will be back pain. Back pain is the most common symptoms for the TB of the spine. So this is your previous slide, the paradoxical, centered, anterior, or the appendiceal lesions. Okay. So shall I move in the next part? Okay. So yeah. So now these are the one of the complications you will find in the that is your TB of the joints, that is in the POTS disease. So cold abscess, if they can ask you what is the most common complications, your answer will be the cold abscess is the most common complication of the POTS disease. This can be another multiple choice questions, okay, and important MCQs. Now, what is this cold abscess? You will see a painless swelling, insidious onset. These are the most common side, that is neck and the axilla, also in the groin, back side of the chest wall. Okay, they are soft in consistency, cystic consistency, fluctuation test is present, okay, because of the fluid, and sleep sign is negative. Sleep sign is negative. Why? Because sleep sign is usually positive in the lipoma. Okay, if you feel that if you palpate or if you just hold the lipoma, you will see that it sleep. Okay, but in case of cold abscess, they look like a soft swelling, but they do not sleep when you feel that swelling. Okay, so that is a differentiate pointing with between the lipoma and the sleep sign, lipoma and the cold abscess. Okay, so sleep sign is positive in the lipoma, but it is negative in the cold abscess. Okay, so site is commonly in the neck and the axilla, groin, backside, the chest of the wall, and this. So these are the sequel of the tubercular infections of the spine and the ribs. Okay. So the common symptoms, there is a back pain. Okay, cold abscess is the most common complications. Back pain is the most common symptoms. Okay, so these are the other features when it has some neurological deficits. Okay, the other symptoms of the tuberculosis. Okay, now the blood showing test raised is ESR. Mantoux test is positive. Narrow disc lesions and lytic lesions. Earliest radiological signs will be the haziness of the margins of the vertebra. So this is one of the important point, haziness of the margin of the vertebra. Okay, so please write it down. Okay, so these are the some of the features. Just give me only few seconds. Just write it down, this slide one, this one. So your POTS disease is finished now. In the next, okay, there is one thing, just wanted to tell you what is the most common investigation of the choice. The MRI is the most common investigation of the choice. IOC is the most common investigation of the choice for the POTS diseases. Okay, so this is all about your POTS disease. Okay, let's give me a few minutes. Let's start with the next slide. So what do you mean by the Keri-Sika? Keri-Sika is a, one minute, huh? Tuberculosis of the shoulder joint. Okay. So the three triad, this is very important. What do you mean by the Phemister triad? Okay. It juxta-articular osteopenia, peri-articular erosions, and the reduced of the joint spaces. Okay. This three together is called a Phemister triad. Okay. So, so TB of the hip. Just let me know if I want to move the last slide. Okay. So infection of the TB. So basically infection of the hip secondary to the primary focus. Yes, the primary focus is either the lungs or the GIT. Okay. And from here, the via the hematogenous or the bloodstream, it can goes into the other part of the body, especially in the hip joint. In the tuberculosis of the hip, they can ask what is the most common part. Okay, so acetabular roof, followed by the epiphysis, followed by the metaphysis of or the great and trochanter. Okay, so this is very important. ठीक है, जितना मैं पढ़ा रही हूँ उतना होने से ही होगा. Okay, and really the disease may start in the synovial membrane and may remain as synovitis for the month. Okay. Okay, previous slide. This one. This is Dr. Alisha. Okay. So, yeah, let's move to the next part. Okay, so what are the clinical features for the TB of the hip? Obviously, there is an pain, onset is insidious, not the sudden onset. Second feature will be this can be this type of the question they can ask you as an clinical based questions. Okay. So pain and swelling in the hip, limping are usually the presenting symptoms. Sometimes if there is a pain in the hip, the pain is referred to that of the knee. Often you think that is a case of the knee joint pain. Yeah, the referring pain is goes to the knee. Pain is maximum at the end of the day. Other than this, tuberculosis, the symptoms of tuberculosis such as loss of weight, fever, okay, and limp is the earliest and the commonest sign of the tuberculosis of the hip. So this is the important one. What is the most earliest and the commonest sign? This is the limp. Okay, limp is the earliest and the commonest sign for the tuberculosis of the hip. Now, stages of the tuberculosis of the hip: synovitis, early arthritis, advanced arthritis with the sequelae. Okay. So this is important. In first stage, they limited only the synovium. I told you before that limp is the earliest, and sometimes the disease may start with the synovial membrane and may remain synovitis for the month. So this is in the early stage. Okay. The early stage is synovitis. Infections limited to the synovium. So there is a joint effusion, synovial hypertrophy. So Faber test is positive. That means flexion. AB for the abduction and ER is the external rotation. This is your mnemonic for the synovitis in early stage. Faber test is positive. Pain or restriction of the hip joint indicates the hip joint pathology. Commonly, Faber is positive in the tuberculosis of the hip, osteoarthritis of the hip, and the TB or the septic arthritis. Okay, so this is one of the important MCQ questions. In which state the Faber is positive? Okay, so ये भी एक questions है. They can ask you questions within the questions. That is, Faber test is positive in which diseases? That is in tuberculosis of the hip, osteoarthritis, and the septic arthritis. Okay. Now, these are the clinical features. If I'm going too fast, do let me know. So, dull aching pain in the hip and the groin, limping, muscle spasm. Now, this is a position of the comfort. Okay. So, position of the comfort, muscle spasm, that is hip assumes a position of the comfort, that is flexion, abduction, and the external rotation. Okay, that is your uh, flexion, abduction, and the external rotation. That is in the early stage. Okay, so because of this deformity, the limb appears longer, but true limb length is the normal. Okay, so this is called your apparent lengthening. Okay, so this is called the apparent lengthening. So in the first clinical feature, what you will see that Faber is positive, limb appears longer, but true limbs length is normal. So this is called as an apparent lengthening, right? Now come to the next part. Now stage 2, so this is the first, that is early pre-arthritic stage. Now stage 2 is your arthritic stage. Here you will start to notice that limbs may appear slightly shorter and there is an increased pain, and from the synovial the disease spread to the articular cartilage. So articular affection in the articular cartilages of the bones, the marginal erosions begins. Okay, joint space started and the osteoporosis started. Okay, so this is in the stage 2 of early arthritis. Okay, of the TB of the hip. Okay, so here in the first stage, what you will see that the tooth may appear smaller, but it is normal in length. But in the stage 2, there is an actual shortening of the length. The true shortening not more than 1 centimeter. Okay. So true shortening is noted from the stage 2. So this can be one of the important. Okay. The stage 2. Number 3, in the case of the stage, it is advanced stage or the destructive stage. Here you will see that severe pain, limb shortening is there, and marked deformities of the joint and destructions of the cartilages and the bones. Okay, so these are the important clinical feature according to the stage wise of the TB of the hip. Okay, so remember this one, it has a stage 1, stage 2, and the stage 3. Now in the stage 4, with the further destructions of the capsules, ligaments of the head of the femur. Okay. Okay. Now in the stage 4, what you will see in the X-ray, wandering or the migrating acetabulum. Okay. So this is very much positive in the X-ray. That is, wandering acetabulum may be seen, and there is a true shortening of the legs. And FADIR is a positive flexion, adduction, and the internal rotation. Okay. And here in the 4th stage, cold abscess burst, and there may be discharge out of the thin pus. Okay. So these are in the stage 4 in the TB of the hip. Remember, the most common, whether it is bone TB, whether it is spinal TB, whether it is TB of the hip, the most common complication is the cold abscess. Okay, just write it down. So this is all about from the diseases of the bones, about the TB of the hips. Okay, am I moving too fast? So, okay, let's move to the next part. So this is a radiograph of the joint. Wandering hip. Okay, wandering hip is a sign of which disease? Your answer will be tuber TB of the hip. Okay. Now come to the prolapse intervertebral disc. So basically, what is this? Herniation of the disc. Okay. Okay. Cold abscess seen only in. It is a basically tuberculosis of the joint. Okay. So whether it is there must be some TB of the bones, and this is the common complications of the TB of the bone. The TB can be happen in anywhere, especially in the bones part. Then you will get the cold abscess. Okay, but only in the joint, in the bone. Affection will be the bone. Okay. Now come to the prolapse intervertebral disc. Okay, so cold abscess का मैं और बता देती हूँ better, so it will help you to understand. The cold abscess कहाँ गया? Where it is? Sorry. Yeah, in the cold abscess, there will be a painless swelling. Okay, no heat. Okay, so there will be cold, so no heat, no redness, and no pain also. So this is why it is a typical sign of the cold abscess. Okay, especially in the bone and the joint TB. It's the most common form. Any type of the tuberculosis of the joint, you will see that the cold abscess. The cold abscess can occur also in the lymph node, but most common it is seen in the spinal tuberculosis. But tuberculosis of the hip also can result in the cold abscess. Okay, the tuberculosis of the rib, tuberculosis of the hips. Okay, if there is a lymph node affections, okay, then also there will be a cold abscess. The बाकी symptoms है. Now come to the last, this is the prolapsed intervertebral disc. Okay, so that is means your herniation of the disc. Okay, so our disc contains these two things. One is your annulus fibrosis and other is nucleus fibrosis. So basically this contains some gel-like properties. Okay, and this gel is help in the our like cushion. It acts like a cushion. It's a weight, help to it's type to maintain the integrity of the joints. Okay, so now this what happened in the prolapsed IVD in this type of the like collagen, it consists collagen also, type 2 collagen, they get herniated through this opening. Okay, So this is normal disc. Now the second stage, there is a degeneration of the disc. From that, there is a disc bulge and herniation, that whatever the material comes there, it comes from this opposite side. Okay. And usually the most common symptoms will be the back pain. Okay. And suppose, for example, this is your toothpaste. Okay. Okay. And toothpaste consists of that material. Now suppose this material is a collagen, consists of some water. Okay. Some collagen materials are there. Now this, it is going, now if you press this tube, what this thing, now the material, it comes out from the opening. Similarly, in the same thing is happened in the herniated disc. Whenever you move forward, जब भी आप झुकोगे, okay, when you bend downward, the pain in the back increases, and also herniation of the disc is also increases. So whenever there is a patient who is suffering from this bulge disc or the herniated disc, herniation of the disc, you will tell them not to move downward. Okay, not move, now to bend downward, sorry. Okay, so bending downward should be avoided by a patient who are suffering from the herniated disc. Okay, so and the most common symptoms will be what? The most common symptom is the back pain. Okay. Now come to the, what are the common site. Common level is the most common is L4, L5, S1. Cervical will be the C5, C6. Clinical features, low back pain. If there is an affections in the sciatic nerve, so there is an pain. All the clinical features of sciatica will be present. Positive SLR test, if you tell the patient to lie down and tell the just raise your leg, the patient is unable to raise his leg. So positive leg raise test. Okay. So this is the clinical features of the disc. That is your disc prolapsed. Okay. Intervertebral disc prolapsed. Now, if you see this herniation, it compresses the nerve. If the sciatic nerve get compressed, the most common symptoms, all the features of sciatica you will see. What are the most common imaging technique? X-ray. See, this is one important question. If they ask you what is the most common, now person is suffering from the earliest manifestation of the IVD. Okay. Now patient is comes to you and he will giving you all these symptoms. I am having a back pain. I am not. So suppose if I bend downward, if I bend downward, जब भी मैं नीचे झुकने जाता हूँ, and जब नीचे से जब ऊपर उठता हूँ, when I just raise my back, then I have got a severe back pain. Okay. Along with this, I have some numbness and tingling sensation in my right or of the left leg, whatever in which nerve is affected. Okay. Now, this is in earlier stage. In the earlier stage, the most common investigation will be the MRI in the earlier stage. Okay. In the later stage, you can do the X-ray. Then you will see that narrow disc spaces, loss of lumbar lordosis. Okay. But in the MRI of the lumbar spine, this is the earliest technique. Earlier stage may you can always do the MRI, because in early stage of the intervertebral disc you won't find anything in the X-ray and also in the CT scan. Okay, so if the question asks what is the most common investigation to be done in a patient who is suffering from IVD in the early stage, your answer will be the MRI lumbar spine. Okay, so remember this, these are the all important imaging technique, but in the early stage the MRI lumbar spine should be done. Okay. Now let's come to the one of the questions. Okay, अभी questions बाद में देखेंगे. Let's go with the tubercular tensinovitis. Okay. So what is this tubercular tensinovitis? It is basically what happened. It is a chronic granulomatous inflammation of the tendon sheath. Okay. So basically it is a chronic granular formation of the granulation, that is a granulation tissue, especially in the tendon sheath. So formation of the granulation tissues which looks like a rice body. So this is one of the important MCQ pathognomic sign of the tubercular tensinovitis, rice bodies. Okay. So this is important MCQ. Where you will find the rice bodies, a pathognomic sign of the tubercular tensinovitis is the rice bodies. Common site, flexure tendon sheath of the hand. Okay. This is one of the important. Which form? That is your flexure tendon sheath of the hand. Now, similarly, remember this. These are the secondary TB. The primary one will be in the either in the lungs, that is the TB in the lungs, via the hematogenous spread. It goes into this area, or there is a TB of the bone. Okay, adjacent bone or the joint TB, and from there it affects into the particular site. Okay. So what are the clinical features? There is an slow growing or the painless swelling, restricted finger movement, minimal redness or the warmth. It feels more like a cold abscess. They always have a history of whenever you find this type of the like patient, he has a swelling in his palmar except there is a slight bluish discoloration. Okay, and the pain is there, but it is very mild pain. Okay, reduction of the finger joint. If you ask him whether you ever suffer from the TB, so there is a history of the TB. Okay, especially might be in the like in this past history, he or me she might suffer from the TB. It can be lungs TB, it can be GIT TB, or it can be your TB of the other joint. So from the white hematogenous spread, it affects in the palm. Okay. So what are the investigations? MRI, best imaging modality, ultrasound, synovial thickening. Definitive diagnosis will be the biopsy, which you will see this cystatic granuloma or the Langerhans joint cell. Other than this, MANTU test is also positive. Okay, MANTU test is a positive, and AFB stains for the confirmative, and E and the FNSE will shows your cystatic granuloma. Okay. So these are the common clinical feature. ठीक है. So मैंने एक ही slide में cover कर लिया है so that you can click it and save it. Okay. Remember, this is important, most common part, clinical features, and this is very important, the granulation tissue, the rice bodies. Okay. So what are the complications? Obviously, if there isn't too much pus formation, so obviously there isn't tendon rupture. So I think, yeah, so I can writing here the complications. ये लिख लेना, what are the melanocytes bodies, that is rice body, same thing, important MCQ is the most common cause of the rice bodies, TB synovitis, common site, best investigation. So these are very important. Now, what are the complications? Complication is a tendon rupture. Okay, tendon rupture. Second is joint stiffness. Third is your if there is an affection in the, if it can affect the pressing the median nerve, then the carpal tunnel syndrome. Okay. So these are the some of the one liner of the important tubercular tensinovitis. जितना ऑर्थोपेडिक में पढ़ा रही हूँ उतना ही पढ़ो, तो बेसिकली उतना only 1 or 2 क्वेश्चंस ही आते हैं. ठीक है. Okay, now let's move to the next part. Yeah. So, Jay, can you just tell me the answer of this? As per the World Health Organization, which of the following DXA scan finding qualifies the definition of the osteoporosis? ये questions आया था in UPSC. Okay, just tell me the answer. So yes, the answer is T score is less than 2.5 the lumbar spine. So this is the, remember this one, take a diagnosis and the T score. सीवियर ओस्टियोपेनिया ओस्टियोपोरोसिस, ये याद रखना. ठीक है. It is if your normal should be what the T score of the severe osteoporosis should be what. Okay. So तो ये याद रखो. एंड सॉरी, Hmm. So let's move to the another part of osteoporosis. Okay. So osteoporosis is a systemic skeletal disease characterized by the low bone mass with, so basically what happened in the osteoporosis, we have in the body, that is osteoblastic cell, that is new bone formation, and other is your osteoclast cell. Okay, that is whenever there is a formation of the new bone, there is a destruction of the old bone cell. So what happened? The bone density in osteoporosis may what happened? There is a bone density decreases. The formation of the new bone has become decreases. Okay. So low bone mass. As a result, there is an increased bone fragility or the fracture risk. So what are the causes? The causes, they are divided into two types. Okay. So whenever there is a bone density decreases, the bones become porous, they become weak, and which resulting into the easy fractures. Okay. So here is what happened. There is an osteoblastic, that is, and the osteoclast. One is your bone resorption. Okay. The bone resorption is more than that of the bone formation. So न्यू बोन फॉर्मेशन नहीं होंगे और जो ओल्ड बोन है दे आर वेरी फ्रेगाइल. Okay, so that is why that bone density is low. Okay, bone density is low. So these are the type. The causes is secondary causes, use of too much steroids in the hyperthyroidism, okay, malabsorption syndromes, chronic kidney disease. If there is a chronic kidneys, okay, the vitamin D is not going to convert it into the active form. So calcium, the iron decreases in the body. These are the secondary osteoporosis. These are some risk factors. Increasing age, female has more chances to develop osteoporosis. Okay. Low BMI, smoking and the alcohol, and long-term use of the corticosteroids. Okay. So usually clinical features will be the back pain. The most common symptoms will be the back pain. Okay. So in the vertebra, what you will see that is codfish vertebra. Okay. Intervertical disc may intrude into the centers of the vertebral bodies, and it looks like a fish, codfish vertebra. Okay. The best diagnosis, how will best diagnosis test will be the DEXA scan. Okay. And the X-ray to know the advanced diseases or the advanced fractures. So if they ask you, the DEXA scan is used for to know the like your bone mineral density. Okay, to find the bone mineral density, we do the DEXA scan. So the scores, that is what about the T score? Okay, so wo yaad rakhna. So these are the all the clinical features of the osteoporosis. So what the DEXA scan measure? It measures the calcium content in the bone. Okay, so there is a formation of the in the bone is formed by the calcium and the phosphorus. Okay, sorry, not the potassium, and the phosphorus. Okay, so calcium and the phosphorus, the content of the calcium and the phosphorus in the bones, and what is the bone strength. Okay, and this was measured by the T score. So you should remember this one. Okay, diagnosis of the T score is used to diagnose the uh, what is the bone density, and usually the bone density is less in osteoporosis. Okay, so these are all about of so fracture is most common. If they ask you what is the most common fracture, your answer will be the fracture of the femoral neck. Okay. Or sorry, not the femoral neck, intertrochanter fractures of the femur. So this is the most common fracture in the osteoporosis. These are the other common site: vertebra, distal radius, that is your the Colles fracture. The most common in the femur fracture, okay, especially the neck of the femur and the distal radius and the vertebrae. Okay, so these are the most common site will be the D12L1 in lumbar vertebra. Okay. Now just tell me, what are the common site where the osteoporotic fractures frequently occur? Yeah, the answer is the hips and the spine. Let's move to the another. Which of the following is not a known risk factor for the osteoporosis? Is it sedentary lifestyle? Okay, not a known risk factor. Um, no. The answer is body weight, high body weight. Okay, sedentary lifestyle is also the one of the feature for the osteoporosis. Okay, calcium and movement is always necessary. So calcium, vitamin D deficit, answer is high body weight. Now come to the osteopetrosis. Okay, so what do you mean by the osteopetrosis? Okay, its other name of the disease is marble bone diseases. Now, if you see the picture here, what you will see here, that is there is a widening of the metaphysis. Okay, so long bones are usually affected in the osteoporosis, and in the X-ray we will see that dense metaphyseal bands, and there is a widened long bones. Now, these long bones are widened in the metaphysis region. Now, this is known as your Ehlers flask deformity. Very important questions. Ehlers flask deformity is seen in where? In the osteopetrosis. What happened? So, there is an metaphysical bands, and also the long bones, especially the long bones, are widened in the metaphysis and the diaphysis region. Okay. So, if you see that there is an symmetrical constriction here, okay, of the diaphysis, but there is an again there is a dilatation of this part, metaphysis part. Okay, so long bones are widened in the metaphysis and the diaphysis, and there is some band are seen. Now just tell me the answer. Other thing is this: in osteopetrosis, what you will see that here there is an other than the uh, medullary cavity affections, the clinical feature, the patient may suffer from the anemia, they may suffer from the pancytopenia, thrombocytopenia, or the hepatosplenomegaly. Okay, I will come into the later stage. Now just tell me the answer of this. Raju, who is 10 years old, present with the predisposition to the fractures, anemia, hepatosplenomegaly, and the diffusely increased radiographic density of the bones. X-ray shows bone within the bone. Okay. So what is the answer? Okay. The answer is osteopetrosis. And what happened here? Now come to the what actually happened. ठीक है, फिर हम लोग उस स्लाइड में जाएंगे जहां ये क्वेश्चंस है. तो बेसिकली ओस्टियोपेट्रोसिस टू फॉर्म में होता है. वन इज योर autosomal dominant, another is your severe one, which is autosomal recessive. Remember, autosomal dominant is most common than autosomal recessive. Okay, here the bones become hard, dense hard, because metaphyseal bands are seen. It become hard and brittle and fractures. Okay, normally what happened in the osteopetrosis, there is an decreased functioning of the osteoclast. Okay, so there is an osteoclast means destructions of the bones. Okay, so destruction of the bones, and the osteoblast means formation of the new bones. In osteopetrosis, what happened? There is a decrease reabsorption of the bones. That means, so we have old bones and the new bones. That is means your osteoblast means formation of the new bones, new bone formation. In osteopetrosis, what happened? This osteoclast decreases. Okay, so reabsorption of the old bones does not occur. So what happened? There is a persistence of the primitive bones, means the old bones. Okay, that is your, there is a persistence of the primitive bones, and this primitive bones are very much fragile, brittle in nature. Okay, that is why you will see a huge collections of the bones. So there is an increased density of the bones. The bone thickness is also increases, but the bones which are present, they are the old bones, so they are easily uh, brittle. Okay, so here in the X-ray, you will find this sandwich vertebra. Okay, very important MCQ, where you will find the sandwich vertebra. एक था codfish vertebra, you can find in the osteoporosis, and osteopetrosis में sandwich vertebra, that is bone within the bone. Okay, see this one, this is bone within the bone. Okay, along with this, the osteopetrosis clinical, the features of severe anemia, recurrent fractures, growth retardation, deafness, blindness, and also known as your marble bone diseases. Okay, here level of the calcium is normal. Okay, level of the alkaline phosphate is also normal. Okay, in adult. In children, there might be slight decrease of this. Okay, so also you will see that there is a widening of the skull. Okay, so widening of the skull, so there is a compression of the cranial nerve. So blindness is also the features. Okay, so deafness and blindness, it's mainly due to the, if there is a compression of the nerve in the brain. Okay, so bone, so now you can understand this, with predisposing to the fractures, anemia, hepatosplenomegaly, and the increased radio density of the bones, because there is a new bone formation is too much, but the new bone formation is normal, but the old woven bone or the old bone, okay, they cannot reabsorb. Okay, so there may be too much bone. That is why radiographic increased density of the bones, and X-ray shows bone within the bone, which is known as a sandwich vertebra, seen in the osteopetrosis. In osteoporosis, we find the codfish vertebra. Okay? So this is all about your osteopetrosis. Am I going too fast? If I'm going too fast, you let me know.
मैम क्वेश्चन वाला स्लाइड थोड़ा सा
कौन सा स्लाइड?
क्वेश्चन जो था
Osteoblast.
क्वेश्चन जो था।
अच्छा क्वेश्चंस ये वाला, ओके
ओके मैम।
ओके। चलो then let's move to the next part, osteogenesis imperfecta। ठीक है, तो osteoporosis हो गया, osteopetrosis हो गया, now come to the osteogenesis imperfecta। okay, so basically this is a condition which affects the collagen। okay, it affects the collagen, they are also autosomal dominant, it is a hereditary connective tissue disorder, defective type of the type 1 collagen। remember the type 1, we know that the collagen, the type 1 help in the formation of the bones, you know, four type of the collagen is there, type 1, type 2, type 3, type 4। okay, the type 1 help in the formation of the bones। 1 minute So type 1, it helps in the formation of the bone, skin, and the type 2. So let's move it here. This is also a very important MCQ question they can ask in anatomy. Type 1 means 1, formation of the bones. Okay. This type 1 collagen help in the formation of the bone, skin, and the tendons. Okay. Here what happened? There is an defect in the type 1 collagen. So all this, that is bone and skin, all are get affected. Okay. Now type 2 help in the formation of the cartilage. Okay. Type 3 help in the formation of the fibers, reticulin fibers। Important multiple choice questions हैं from the anatomic view, they can ask you what the type, maximum type 1 ही पूछता है, type form 4 is the basement membrane। okay, so what happened in the osteogenesis imperfecta, there is a defective of the type 1 collagen synthesis। ठीक है, that is why fragile bones and the recurrent fractures, autosomal dominant, mutation of the this COL1A1 gene or COAL1 genes। okay, so this is the basically mnemonic, इसको याद रखना, Bob like collagen test, that is blue sclera, loss of hearing, capillary bleeding, C for the capillary bleeding, F for the fractures, or the blue sclera, BDSM, that is your deformed teeth, S for the sensorineural hearing loss and the multiple fracture। okay, the multiple fracture, the bones are brittle। okay, so these are the some mnemonic, itna yaad rakhne se hi hoga। and yeah, multiple fracture in the infant, and there is an possible with whatever the bone is present, there is an immature bone। okay, so bone which is present here also, they are not, even in the new formation of the bones are the immature bone, which is known as your Wuben bone, new bone, but the immature one। okay, now just tell me the answer. Which of the following is the common symptoms of the osteogenesis imperfecta? Hyperpigmentation of the skin, joint stiffness, hearing loss, increased muscle mass. Yes, the answer is hearing loss. We know that joint stiffness is not there, laxity of the joints is there। okay, so there is an ligaments become laxity। okay, so joint laxity are there, stiffness is not there, the answer is hearing loss। okay, now come to the Paget disease। Paget disease, what happened? There is an timing of the osteoblastic and timing of the osteoclastic. What happened? This timing is not maintained. So overlapping of these two. This is basically happen in the Paget diseases. Okay, so there it is also known as your osteitis deformans। okay, तो यहाँ पर क्या मिलेगा सबसे एमसीक्यू इंपॉर्टेंट, कॉटन वुल स्कल। ओके, कॉटन वुल स्कल और changing hat or the helmet sign। okay, you will see that there is an also the malformation of the tibia in the bone, also you will see that malformation of the tibia, that is anterior bowing of the tibia। another classical X-ray sign. In the skull, you will see the cotton wool skull. In the X-ray of the tibia, anterior bowing of the tibia. You will find in the Paget disease. And what happened in the Paget disease? The osteoblastic and the osteoblastic cell, they mix together. Now, if you see this in the slide, there is an metabolic disease. There is an increased bone destruction and the remodeling because of the overcoupling or the infrequent coupling of the osteoblastic and the osteoclastic cells. So there is a pain in the bones, increased bone density, cardiac failures, skull or the sclerotic vertigo just looks like a cotton wool. There is an increased alkaline phosphatase. Okay. Now these are the some of the phases. This is I wanted to say that is osteolytic phase. It is an initial phase. So there is an excessive bone resorption. Okay, there isn't too much bone destruction is there. The bone get absorbed, so they can destructions of the bone becomes weak and the painful. Now in the second phase will be the mixed one, osteolytic and the osteoblastic. They most commonly this phase at the diagnosis, this osteoblast and they act together, resulting into the new formation of the bone which is disorganized. In the mixed phase you will see the cotton wool appearance. ठीक है, ये भी पूछा जा सकता है in which phase, oh not much in deep, but just remember this, in which phase you will see the cotton wool appearance. In the mixed phase of the Paget disease we will see the cotton wool appearance. Okay, now in the third phase, that is known as your burnt out phase or the late stage, there is a predominant osteoblastic activity, too much bone formations, bone become dense but brittle. Here, high risk of pathological fracture because even the bones which are forming new bones, they are the brittle bones. Okay, and in this stage, they have a diagnosis or chance of getting the osteosarcoma due to the excessive formations of the woven bones. Okay, here the main thing is that serum alkaline phosphate is increases, but the calcium level is normal. Okay, so calcium level is normal. So Paget disease में क्या होता है? Osteolytic phase, for there is an destructions. Now there isn't too much formation. Then the mixed phase, okay, lytic phase. Then the mixed phase, and the other one is your sclerotic phase. Okay, formation of the too much bones, which is an sclerosed bone, and these bones are the woven or the very brittle bones. So this three together are known as a Paget diseases, and these are clinical sign and symptoms. Remember, if the skull is affected, also this type of the patient may suffer from this hearing loss. Okay. Okay. So most common bone affected is your pelvic bones. Now, which of the following is a characteristic feature of the Paget diseases? Yes, alkaline phosphatase level. Osteopenia means decrease of the density of the bone seen in this. ठीक है, osteoporosis, osteomalacia, osteobachy में osteopetrosis, there is a because increased density of the bones. Okay, and the Paget disease may be increased density of the bones, but here these are the disease where you will see the decreased density of the bones. Now come to the
मैम थोड़ा पीछे
osteomalacia.
स्लाइड जाइए ना थोड़ा सा.
ये वाला, this one.
नहीं ये नहीं इससे भी आगे, इससे आगे. हाँ ये वाला.
Okay.
ओके.
चलो, हो गया? So
हाँ मैम.
move to the next part. Okay, osteomalacia. बहुत important, the same thing. In children, we will know it is known as an ricket, and in the adult, is known as an osteomalacia. The causes you know, Okay, there may be some inadequate mineralization of the bones. Either there is a deficiency of the vitamin D, or vitamin D is there, but its absorption is not present. Okay, or the patient may suffer from the decreased calcium level in the body due to hypoparathyroidism, or the person is suffering from the chronic renal failure, or there is some malabsorption, means he is taking all the nutrients, because of malabsorption the nutrient is not getting absorbed in the bodies. Okay, so these are the some of the causation for the osteomalacia and the rickets. Okay, so and here the most important, the clinical features they can ask investigation mein what you will find, the imaging. Okay, so milk loser zone or the milk line fracture or the pseudo fracture, these are the seen in the osteomalacia. Okay, so x-ray finding is very important for your MCQ. ये कहाँ पर मिलता है ना, this type of question they ask you either in the like osteoporosis, osteomalacia, osteopetrosis दे दिया, and they can ask you the X-ray finding and now match the following. So these are very important. Okay, so X-ray में क्या मिलेगा हमको, loser zone, milkman zone और the pseudo fracture zone. Remember here the calcium level is decreases. Okay, parathyroid hormone is either there is an increases, if there is an vitamin D is decreases, but alkaline phosphatase जो level होगा that is increases. Okay, usually pseudo fracture you will see the X-ray of the joint will show you the pseudo fracture. So there is a bone pain, especially the spine and the ribs are affected. The bones pain may, especially the spine, either the patient may complain of the spine pain or the hip pain, okay, or the ribs pain. Okay, so pelvis may pain, hip may pain, ribs may pain, and the spinal pain. Because of this like weakness in the muscles of the thigh, so there is an climbing stairs become difficult. So difficult in climbing the stairs. So I'm just writing it here. In osteomalacia, there is a difficulty in climbing stairs or getting up from sitting. So basically anterior thigh muscle, whenever the anterior thigh muscles are weak, now these are the very important symptoms, whether it is an adult or in the children, difficulty in the climbing the stairs and the getting up from the sitting. But among this most important is this one, loser से, ये बहुत बार पूछा गया है. ठीक है? Now come to the, now just tell me, a young man having pain with the daily morning stiffness of the spine for 30 minutes and the reduced chest movement, all the tests are used is given condition except fleshy test, pump handle test, Faber test and the Scopper test. पहले तो मुझे बताओ what is this disease condition and then you will tell me the answer. पहले बताओ what is this disease condition. Young man है with morning stiffness of the spine for 30 minutes. This you have already like read in when studying in BHMS, especially the practice of medicine questions. So can you just tell me the what is the diagnosis? क्या हो सकता है diagnosis? इसका तो बाद में देखेंगे. Just tell me the diagnosis. A young male, okay? एक तो एज यंग है, डेली मॉर्निंग स्टिफनेस, उठ के ही बहुत स्टिफनेस रहता है बॉडी में एंड इट लास्ट फॉर 30 मिनट. द पेशेंट यू विल टेल मी जस्ट रब द बैक, then only I can get up. Okay, and also there is a reduced chest movement. So what is the diagnosis? Anybody? कुछ समझ में आ रहा है? So basically this is a diagnosis for the, yes, very good, ankylosing spondylosis. Okay, ankylosing spondylosis. ठीक है? So in ankylosing spondylosis, we will do this all the three tests, that is fleshy test, Faber test, and the Scopper test. These are the tests for the ankylosing spondylosis. Only the pump handle test, usually this is used to detect the tear in the shoulder joint, in the glenoid labrum. Okay, so there is basically, if there is a tenoid in the glenoid, then only this test is used. So among this, all the tests are used in this condition except the pump handle test. Okay. So now this is important, Scobart test. Now what is Scobart test? Usually suppose the length of this from the L5 vertebra say up to that of the examiner's hand, which plays in one region, and this and suppose the region will be like about 5 or 3 centimeter हुआ. Okay. Now this what to say now, this measurement will increase if you tell the person to bend downward. Okay. So if you tell the person to bend downward, what you will see that this the length is increases. Normally यही होता है, ठीक है, normal person. But if the person is suffering from ankylosing spondylitis, you will not see this. The length will be the same. Okay, the length will be the same. So suppose if the distance is about 5 centimeter, यहाँ पर like the examiner place one hand finger 5 centimeter below, इतना याद मत रखो. The same thing is that suppose distance उसका 5 centimeter है in normal in a standing position, if you bend this distance will increases. Okay, if you place the hand here and the plus hand here and you tell the patient to bend, now this distance is increases. Okay, the same distance is increases, but in ankylosing spondylitis the distance doesn't increase. Okay, so this is an indication of a Scobart test. Another is your occiput to wall distance or the Flechette test in ankylosing spondylitis. You will find that there is a distance between this occiput to that of the wall, which is not present in a normal person. Okay. The severity of the cervical flexion deformative in ankylosing spondylitis is assessed by the measuring the occiput to wall distance. Normally, there is no space, but in case of ankylosing spondylitis, the distance increases. Okay, now Patrick test, now also known as your Faber test, we know as ankylosing spondylitis. The most common affected is your spine bone, and that also most common affected will be the hip area. Okay, so presence of hip pathology by the attempting to reproduce the pain in the lumbar region, and so this is leg to be flexed, abducted, and externally rotated, and during this, a patient may complain of pain. Faber test is a positive. Okay, so these are the 3 tests used for the ankylosing spondylosis. ठीक है?
मैम स्कॉबर्ट टेस्ट एक बार दिखाइएगा एक बार.
Scobart test. Okay, this one. 1 minute. Let's want to bring my. Now let's move to the next part. Okay, there is another test. इतना टेस्ट याद रखने की जरूरत नहीं है, ठीक है, ये पूछता नहीं. Those person who are doing MD in orthopedic, they need all these things. आपको MCQ में इतना नहीं पूछा जाएगा, ठीक है. So question, okay, so this is the question. Yeah, this is the question. Okay. Chalo. Shall I move on to the next part? Okay, I need to complete it. I don't think so I can complete this by today. So I need another class. एक class में 2 class होगा तो orthopedic आपका complete हो जाएगा. Because it's so big and चलो. Let's move to the another part. Yeah. This is the ankylosing spondylitis. ठीक है? So इतना तो याद हो गया आपको कौन कौन सा टेस्ट यूज होता है. And the clinical feature will be the joint most commonly affected is your sacroiliac joint. Okay, sacroiliac joint. And the back pain, what is the, if you see this clinical feature, inflammation of the joint, and there is a fusion of this joint. This is known as your bamboo spine. So X-ray may in ankylosing spondylitis, you will find this bamboo spine. One minute. Let me open this okay, tuberculosis of the joint. Chalo. Okay. So these are the common symptoms. Inflammatory back pain, worse in the morning, improve with the exercise. So this is very important. Ankylosing spondylitis now usually seen in the young patient. Okay, usually start at the age of 16, किसी को 18. Mostly you will see the patient of age one within to 16 to 25 to 30 years of age. Okay, and usually they come to your clinic with the lower back pain. Now this back pain and along with the stiffness usually aggravate in the morning. Okay, usually the spine is affected, lower back and the morning, and along with the stiffness. After some time, this morning stiffness, which sometimes especially it affect for usually 1 hour, or sometimes it is more than, but sometimes most common less than your 1 hour. In the advanced stages, you will see that loss of lumbar lordosis, reduces spine flexion, kyphosis in the late stage. Okay, and there are some extra articular, very important. Okay, among this most common is anterior uveitis. बहुत बार पूछा है. These are the extra articular feature of the ankylosing spondylitis in chest. It presenting in the aortic regurgitation, lungs में lung fibrosis है. Okay, early atrial ankylosing spondylitis, we always do the MRI of the SI joint. ठीक है. Genetic marker HLA-B27 is usually positive. X-ray will show the bamboo spine, eye involvement, anterior uveitis. Very important. Okay. So diagnostic criteria: sacroiliatis, earliest change detected in where? In the MRI. Okay. Other than in the X-ray, in the later stage, you will see that decreased lumbar spine movement, decreased chest expansion. But in the first, you will always go with the MRI. अगर तुम्हारे पास कोई 16-17 का patient आता भी है, very common thing which I've noticed in my case, if you tell the person to go with your like X-ray, you won't find anything. So everything will be normal. You had to tell them to go to the MRI. Okay. We know that we don't need, but it is important to know whether this type of the autoimmune disease are difficult but not impossible. But yeah, always you tell the patient, a patient who is 17, 18, 20 or young age, tell them to go with the MRI. X-ray करने से कोई फायदा नहीं मिलने वाला, especially if they come to you undiagnosed. ठीक है? So let's move to the next part. So this is bamboo spine X-ray. And the uveitis, these are the other depression, heart disease, aortic psoriasis is always present there. Okay. And sometimes the patient only complain with the heel pain. Sometimes there is a lumbar pain, heel pain in a young adult. Okay. Now just tell me the answer. A 20-year-old man present with a chronic back pain that is worse in the morning and improve with the physical activity. He has a history of anterior uveitis. X-ray of the sacroiliac joint is normal. Okay? X-ray of the sacroiliac joint is normal. On the examination, you will see the lumbar lordosis is lost and spinal flexion is reduced. You will tell the patient to bend down. He is not able to bend down properly. What is the best diagnostic modality for the early diagnosis of this condition? Very good. MRI. ठीक है? Can anybody tell me where you will find the anti-CCP antibody? It is found in the, किसी को पता है, NTCCP, very good, RA, rheumatoid arthritis. चलो, let's move to the next part. Okay. So yeah, this is the now a 25-year-old male with inflammatory back pain and reduced spinal mobility, suspected to have ankylosing spondylitis. Genetic marker. HLA-B27. Very good. Chalo. 1995% ankylosing spondylitis patient. Strongest genetic association is there. This I have seen in many cases. A person who is suffering from ankylosing spondylitis, उनके family में किसी न किसी को ये problem रहता ही है. Okay, either their extended family में, it is very positive. Okay, now a patient diagnosed with ankylosing spondylitis complains of sudden onset of pain, redness, and then photophobia of the one eye. Answer is anterior uveitis. Okay. So these are some of the questions they can ask you in this. So let's move to the next part. Loose bodies कहाँ देखने को मिलता है? Just write. Loose bodies are the fragment of detached cartilages. Okay. Or bone inside the joint. This fragment may be seen floating. You know, the most important for the if you see that those, it does not causes anything problem, but in this cases use calcarea float lower potencies. Okay, like 3x, 6x. You will see after a few, like after 6 to 7 months के बाद, you will find those loose bodies inside the joint. I have seen these cases. Okay. So osteoarthritis, osteochondritis, and osteochondral fractures. Okay. So let's move to the another part about acute osteomyelitis. Okay. So by 1:30 we will finish this. जितना हो सकता है ना, उसके बाद हम लोग नेक्स्ट फ्रैक्चर्स बाकी रहेगा आप लोगों का, वो करेंगे. फ्रैक्चर्स होगा और कुछ बोन ट्यूमर्स होंगे, दैट ओनली इज, बाकी का खत्म. ठीक है. 1 minute. Fractures, okay, and nerve affections. Yeah, TB हो गया आपका, TB of the joint. Now, yeah, this is osteomyelitis. Check. The acute osteomyelitis, most causative organism is what? Your Staphylococcus aureus. In case of children, Haemophilus influenzae. Okay. Most common the metaphysis of this, that is your, sorry, the metaphysis. Okay. Most commonly the metaphysis of the long bone in the children. In adult is your thoracolumbar spine is the most common site. Okay, ये सब याद रखना. These are all the one-liner questions. Most common mode of infection is your hematogenous infections. Okay, most common mode of infection. What you will find, remember, sequestrium, it is always found in the chronic osteomyelitis. They are never found in the acute osteomyelitis. Sequestrium is what? Because it's a dead piece of the bone, lighter than that of the live bone, okay, which cause as an result of the infections. Okay, just want to tell you one thing in the later part. Pain in the area of the infection, swelling and redness. Now, this is a sequestrium. This is basically a dead bone. Okay, we know that in chronic osteomyelitis, there is an eating, okay, of the affected bones. As a result, some part of the bone comes out, and this is known as your sequestrium. This is basically a dead bone. ठीक है, इसको dead bone बोलते हैं, and it is lighter than that of the live bone and easily breakable. And sequestrium is the most common non-healing sinus of the chronic osteomyelitis. It is a non-healing sinus of chronic osteomyelitis. Okay, chronic osteomyelitis. They resulting into the squamous cell carcinoma. Squamous cell carcinoma is the most common malignancy in the chronic osteomyelitis. Okay. There is one treatment in the dental procedure which is also known as your root canal treatment. You will heard this thing. Okay. Here the what they will do, now this is the teeth. They will take out the infected or the nerve. Okay, whatever the nerves which are dead, they take out the infections also and take out the nerve. Now this nerve does not have that blood supply and they are only limited to this peridental ligament. Now this is a dead tooth only. Now my question is this: if this dead bone, if this can cause an type of this diseases, they causes non-healing sinus, basically it's a dead bone also only, and this dead bones of the pieces which resulting in the infection. So I was thinking of that this a type of the dead bone, if it is present in our mouth, they will also resulting in the same type of the infections. Okay, so this is thought the people are doing, and I have seen most of the cases that they might suffer from sinusitis. Most of the cases there is an head pain, and also they suffer from this tumor of the brains. Very other affections also, but most of the chronic sinusitis, usually maxillary sinus बहुत inflamed हो जाता है. ठीक है. These are the in chronic stage, not the immediate one. Usually after 1 to 2 years or the 6 to 7 months the patient is, or the 8 to 1 year ke baad they start getting some symptoms. Fatigue, any type of any part of the body, anything. Okay. Okay, link. If the patient comes to you and if he has done this type of the dental procedure, tell them since when your complaint had started, and you can see the connection between these two. Okay. So this is the sequestrum or the dead bone. Now type of the sequestrium. Okay. So these are the type. You can just write it down. Most commonly, they ask you the feathery or the flake sequestrium seen in the tuberculosis of the rib. Cork sequestrium found in the cancellous bone of the infections. Ring one, ivory sequestrium seen in the syphilis. Okay. So ring sequestrium, okay, seen in the amputation stump. A rice grain is seen in the amputation, yeah, stump. Rice grain is another one. It is seen in the tubercular. Okay, so this is about your myelitis. Now, squamous cell carcinoma, rice grain seen in the tubercular osteomyelitis. Earliest change noted in the peristral reaction. Osteomyelitis is a patient sickle cell disease caused by the salmonella. Important one. ठीक है? बस हो गया. This is all about your tuberculosis of this. Sorry, acute osteomyelitis. So Brodie's abscess, long-standing chronic osteomyelitis resulting in the abscess, especially in the metaphysis of the femur bone and the tibia. Okay? Metaphysis of the femur and the tibia. So the patient may complain of deep boring pain, which is worse at the night. Brodie's abscess seen only in the in chronic osteomyelitis patient. They have two complications: Brodie's abscess or the squamous cell carcinoma. Okay. Especially which bone is affected? Metaphysis of the femur and the tibia. Okay. So this is poliomyelitis. Acute viral infections usually affect the anterior horn cell of the spinal cord, resulting into the lower motor neuron paralysis. Okay. So it is an acute viral infection. Lower motor neuron paralysis. Positive agents are the RNA virus transmission to the fascio-oral root. Okay. Usually there is a weakening of the two muscles. One is your tibialis anterior. It undergo complete paralysis, and the These are the muscles most commonly affected are the anterior muscles of the thigh, that is our quadriceps femoris muscles. In the muscles of the hand, also the most commonly affected muscles are the opponent's pollicis. Okay. Pathophysiology, from the fish oral route, they enters into the GIT tract and they destroy the anterior horn cell. All the features of the flaccid paralysis or the lower motor neuron lesions feature you will see in the poliomyelitis. पूछता है, poliomyelitis is a lower motor neuron type of the lesions. Okay, deformities are found in the later stage. Okay, so obviously if there is an like this muscles is problematic, if there is an affection of this muscle, there is a difficulty in the rising from a sitting position. Okay, so these are the some of the clinical features for the poliomyelitis. Okay, so anybody have any question? कोई slide अगर किसी का छूट गया है तो बोलो, फिर उसके बाद हम लोग bone tumor करके finish करेंगे. ठीक है, next classes में only fracture होगा and some nerve injuries. It will take only 1 hour or I think 2 hours only. ठीक है, हो सकता है एक क्लास में हो जाए. आप बोलो कोई भी स्लाइड किसी को बाकी है, then I move on to the bone tumor. चलो, let's move to the which of the following occurs at the youngest age. Wing sarcoma, osteogenic, germ cell tumor, chondrosarcoma. ठीक है, the answer is Ewing sarcoma. Okay, let's move to this common bone tumors. जितना है उतना ही
मैम
आप लोग.
प्रीवियस स्लाइड, एक प्रीवियस स्लाइड.
ये वाला
हाँ हो गया. हाँ हाँ.
ओके, हो गया.
हाँ.
Okay, so let's move to this. Yeah, common bone tumor. So wing sarcoma 5 to 15 years. ये important है. Which part of the bone? Diaphysis. What you will see in the X-ray? Onion skin appearance. Very important. ठीक है, ये पूछा जाता है. ठीक है, onion skin appearance. Systematic sign, all these are not important. This is important. Age is important. Diaphysis of the long bone is affected. Okay. Now, onion skin appearance. Okay. Now, chondrosarcoma usually in the 30 to 60 years of age. क्योंकि यहाँ पर क्या बोला गया है? Which of the following occurs at the younger stage? तो Ewing sarcoma at the age of 5 to 15 years. Okay. Whereas the chondrosarcoma, you will see 30 to 60 years. Anywhere in the bone, especially the flat bones and the upper end of the femur. Okay. Common site is pelvis and the shoulder. X-ray will shows a popcorn calcification. Okay, so motile calcification within the tumor, also known as a popcorn calcification. So chondrosarcoma, 30 to 60 years. Now osteosarcoma, 15 to 25 years of age. Metaphysis, lower end of the femur, okay, around the knee, distal femur or the tibia. Okay, you will find here the sunburst appearance. Okay, so this is your sunburst appearance and the Codman triangle. Actually, these are only important. यही पूछा जाता है. Osteosarcoma का age, the common site and the X-ray features. ठीक है. So Codman appearance or the sunburst appearance, osteosarcoma. ठीक है. Sunburst appearance spread via the blood or by the to the lungs. Now, giant cell tumor, osteoclastoma, 20 to 40 years, epiphysis of the lower end of the femur, subbubble appearance. They are benign, but they are locally aggressive. Subbubble appearance. Okay. So subbubble appearance is also seen in the Mesoneum cilius. It is also seen in the cryptococcal meningitis. It is in the head. It's also seen in the toxoplasmosis and also puffed ripe appearances in the CT scan seen in the neurocystic sarcosis. Okay. So these are the some of the MCQ based questions. So इतना ही याद रखना किसमें soap bubble दिखता है, किसमें sunburst दिखता है, कौन सा कहाँ पर Codman triangle. These are very important. And usually they ask in the multiple like match the following questions में इस तरह के questions पूछे जाते हैं. ठीक है. Now osteoblastoma, benign tumor, okay, and occurs in the diaphysis, metaphysis, but never in the epiphysis. ठीक है, never in the epiphysis. Spine are the more commonly affected. Osteoid osteoma, it is another benign tumor, 10 to 25 years of age. Usually the long bones or the end of the tibia is the most common. The patient may complain of severe night pain. Osteochondroma, usually seen, is the most common benign tumor. It's the most common benign bone tumor, not the malignant one. Okay. But they have chances to the malignant, to the chondrosarcoma. Okay. So what happened? The site is only the metaphysis. Endochondroma, 10 to 30 years, small bone of the hand, cartilage tumor arises from the medullary cavity. In the X-ray, you will see the stippled or the ring arc calcifications. बोन ट्यूमर का ज्यादा पढ़ने की जरूरत नहीं है, उनका एक्सरे फीचर्स पढ़ो, एज पढ़ो और कौन सा बोन अफेक्टेड होता है. ओनली दिस थ्री. Okay, if they can ask you what is the most common cartilage tumor, your answer will be your arising from the medullary cavity, your cavity. Okay, then your answer will be your endochondroma. Yeah. Multiple myeloma, here you will X-ray will show your punched out lytic lesions and the Bence-Jones protein. बहुत बार पूछा गया है Bence-Jones protein and seen in where? In the multiple myeloma, and the punched out lesions seen in the multiple myeloma. ठीक है? So metaphysis and the diaphysis, just write it down. Let's move to the next slide. इसको याद रखो. Osteosarcoma, sunburst appearance, wing sarcoma, onion appearance, chondrosarcoma, popcorn calcification, multiple punched out lesions. Okay, and also your lytic lesions or the your punched out lesions. Okay, these are the key feature. Bence-Jones protein, fibrosarcoma, spindle cells. Okay, so their age, which site. This is also very important. Multiple myeloma yaad rakhega, that is your axial skeleton. Wing sarcoma in the metaphysis. Osteosarcoma in the metaphysis, wing sarcoma in the diaphysis. So ये slide को आप लिख लो, और इसका पिक्चर भी आप ले सकते हैं. ठीक है. तो tumor, skull and the facial bones, osteoma, night pain relieved by NSAID, osteoblastoma, spine, pain not relieved by the non-steroidal anti-inflammatory drugs. Most common benign tumor, osteochondroma, small bone tumor of the hand, endochondroma, giant cell tumor will show your soap bubble appearance. ठीक है, soap bubble appearance का और एक भी, that is, this is also very important. This one. ठीक है. So anybody, if I want to, किसी को कुछ देखना है बोन्स ट्यूमर्स में से कोई स्लाइड. मोस्ट कॉमन बोन ट्यूमर ऑल ओवर. Yes, osteochondroma. Good. Punched out skull lesions are typically multiple myeloma. Bone tumor arising from the epiphysis.
मैं मल्टीपल माइलोमा वाला वो क्वेश्चन वाला.
एक मिनट. Just give me a few minutes. Yeah. osteoclastoma. So answer is C. Good. चलो, पेरिफेरल नर्व इंजुरीज में हो गया आपका पेरिफेरल नर्व इंजुरीज. Sorry. Now tell me, a 40-year-old female presenting with the patient with chief complaint of the tingling and numbness in the thumb, index, and the middle finger. What can be the diagnosis? फटाफट बोलो आप लोग, फटाफट फटाफट. कौन सा 40-year-old फीमेल है, चीफ कंप्लेन इन द नम्बनेस ऑफ द थंब इन द इंडेक्स. अभी ये कौन सा सप्लाई करता है इस पार्ट को? median nerve. Okay, so affection of the median nerve. So answer is a carpal tunnel syndrome. Okay, so let's start with the carpal tunnel syndrome. Usually which most common nerve is a median nerve. ये क्वेश्चन आ सकता है. Okay, so the compression, if you see this compressed ligament, the most common nerve they can affect is your median nerve. Okay, and there is a swelling of the contents, so swelling of the tendon sheath and narrowing of the tunnel. 1 minute. Huh? Okay, so abductor pollicis brevis, the median nerve supplies. This one an anatomical question. They can ask you the median nerve supply which muscles? Abductor, opponens pollicis, and the flexure pollicis brevis. So there is an atrophy of this muscles. Okay, abductor pollicis brevis, opponens pollicis, and the flexure pollicis. Most common cause for the carpal tunnel syndrome is diabetes. Another is a thyroid. I have seen the patient who is suffering from the diabetes mellitus and also the patient who is suffering from the hypothyroidism. Okay, they are most commonly suffered from this your carpal tunnel syndrome. Okay, so acromegaly, neuropathy, D for the diabetes, trauma, the hand trap. So this is the most common mnemonic used. Hand is trapped. Okay. Hypothyroidism, A for the acromegaly, neuropathy, D for the diabetes mellitus, trauma, R for the rheumatoid arthritis, amyloidosis, pregnancy, and space occupying lesions. Okay. So remember this mnemonic. So obviously there is a weakness. तो जो muscle को supply करेगा. So there is a weakness of the thumb, weakness of the grip, wasting of the thinner eminence, thinner muscles. So muscle atrophy is there. Okay. What is the common test they use? It's known as a Fannel maneuver. Very important. Okay. Pain and tingling. If you tell the patient to do the arm like this, raise the arm to the shoulder. Okay. Bring the dorsum of the hand together in the midline and hold the wrist for 30 to 60 seconds. After there is you will feel in case of positive, there is a pain and tingling in the numbness in the affections of this part. Okay. That means your Fallon maneuver or the Fallon test is positive, seen in the carpal tunnel syndrome. ठीक है, ये क्वेश्चन पूछा जाता है. Which maneuver is used? Okay. Now carpal tunnel syndrome में positive tunnel sign, tapping on the like in the wrist. Okay, especially on the carpal tunnel that area, there is a tingling and numbness in the fingers. Okay, so this is known as your carpal tunnel syndrome. Okay. Positive, this is known as positive tunnel sign seen in the CTS. Okay. So this is all about your carpal tunnel syndrome. Now come to the claw hand. Okay. So basically, ulnar claw hand में which affection is ulnar nerve. CTS में median nerve. Okay. So remember this, the mnemonic for the ulnar claw hand. How you can remember this? Ulnar nerve injury in claw hand, clawing of the fourth and the fifth, atrophy of the interossei muscles, numbness of the ulnar side, loss of the lumbricals, and the adductor pollicis is weak and the little finger is abducted. Okay. So hyperextension of the metacarpal phalangeal joint. So ulnar nerve का ये mnemonic याद रखो बस. ठीक है. Remember, there are two types. One is partial, another is complete. Complete may you can affect both the ulnar and the median nerve, but the partial is only the ulnar nerve is affected. Okay. Usually called claw hand, one of the most common cause will be the fracture of the medial epicondyle of the humerus. Okay. They can ask you the fracture, which nerve is affected? Ulnar nerve. Okay. In which part of the humerus is affected and fractured? Medial condyle of the medial condyle fracture of the humerus. So partial, complete. Complete consists of both the ulnar and the median nerve is injured, but the partial only the ulnar nerve is injured. Now wrist dropped, radial nerve is injured. There is a fracture in the shaft of the humerus. Okay, so wrist drop, there is a fracture in the shaft of the humerus. Okay, so mnemonic for the radial, your wrist drop, radial drop, radial nerve injury, above the elbow injury, dropped wrist injury in the spiral groove causes your Saturday night palsy. Saturday night palsy may be a radial nerve ही affected होता है, ठीक है? So absent of the ring, wrist and the finger extension, okay? Absent of the ring and the, because there is an, grouping of the whole of the your palm. So overuse or the posterior cord sign. Okay? So anterior cord, posterior cord, all clinical features of the posterior cord sign you will see in the radial drop. Okay. So ये लिख लो, the mnemonic for the radial drop. And the posterior cord sign, that is basically if there is an axillary nerve and the brachial plexus injury. Okay, so there is a deltoid muscles. So what are the sign? You will find it here. There is a flattened shoulder, maybe there. Okay, flattened shoulder. There is a sensory loss of the upper lateral arm. Okay, and also there is an, and especially in the wrist drop injury, you will see that the wrist drop is also there, and deltoid involvement is there. Okay, eighth thumb deformative median nerve injury. Pointing index seen in the supracondylar fracture of the humerus. In supracondylar fracture of the humerus, maybe most commonly which nerve is involved? Median nerve. These are all the one pointer. Okay, eighth thumb deformative affected nerve is your median nerve injury seen in supracondylar fracture of the humerus. Okay. Okay. Trauma to the wrist and the elbow, upper arm, carpal tunnel syndrome. This is also known as a pointing finger sometimes. Okay. So let's do the Saturday night palsy, radial nerve palsy. Okay. Injury of the which injury in the axilla. Crutches pressing the axilla resulting into the Saturday night palsy along with the wrist drop. Okay. Now axillary nerve injury. This is a posterior cord sign. Told you that is flat shoulder. Okay, flat shoulder, fracture of the surgical neck of the humerus. There is a paralysis of the deltoid muscles. Okay, and axillary nerve injury. Previous slide. So this is previous slide. हो गया? चलो. Erb's palsy. This is also very important. Upper trunk brachial plexus injury, C5, C6. This is very important.
मैम फ्लैटेंड शोल्डर बता दीजिए एक बार.
Flat shoulders seen in the posterior cord listens. So basically it is also seen in the Saturday night palsy, but usually more occurred in the, yes, fractured surgical neck of the humerus. There is a paralysis of the deltoid muscles. ठीक है, ये ही याद रखो. Axillary nerve injury में कैसे होता है? Due to the fracture of the surgical neck of the humerus. Axillary nerve supply the deltoid muscles and the teres minus muscles. So there is a paralysis of this muscles. It is also resulting in the dislocation of the shoulder joint. ठीक है?
ओके मैम, रिस्ट रूप, लेकिन मैम
Sorry?
मैम रिस्ट रूप, मैम जो रिस्ट रूप है वो उसमें भी फ्लैटन शोल्डर होगा, सैटरडे नाइट पाल्सी,
वो बेसिकली
Posterior
पोस्टीरियर
cord.
कॉर्ड, हाँ, वो दिस आर द साइन ऑफ द पोस्टीरियर कॉर्ड
Posterior
ऑरिजिन.
cord.
ठीक है? रेडियल नर्व
Okay.
बेसिकली ब्रेकियल प्लेक्सस इंजुरी डिपेंड करता है. यहाँ पर लिखा है ना,
Okay.
अबव द एल्बो इंजुरी इज कॉमन, दैट इज व्हाई. ठीक है? जरूरी नहीं कि हर किसी में यही हो करके. सपोज इफ द पर्सन come with this Saturday night palsy, you will find this in the flattened shoulder in Saturday night palsy. Okay. Okay, now come to the Erb's paralysis, which cause brachial plexus injury C5 and C6. ठीक है? Common scenario during the birth. Okay, if there is a birth injury, the more common nerve is affected is C5 and C6. Muscles, C5, C6 nerve affected your deltoid muscles, supraspinatus muscles, infraspinatus muscles. So there is a sensory loss of the lateral arm, and this is known as a weighted tip deformity. This is weighted tip posture. Okay. सो ये सब वन लाइनर क्वेश्चन ही आएंगे आपको एमसीक्यू में. सो इतना ही आपको जो स्लाइड यहाँ पे पढ़ा रही हो ना, इसको आपको एक आपका ही क्या बोलते हैं ना, एक अभी क्लिक कर लो एंड देन मेक योर ओन नोट्स. यू कैन ऐड समथिंग देयर आल्सो इफ यू कैन. ठीक है? सो दिस इज योर, so up, these are the two like people they can up Dutch palsy is the same, right? This is your weighted tip deformative. Okay, now wasting of the small muscles of the hand, this is known as a Klumpig's palsy due to the damage of the C8 and the T1. Okay, due to the damage of the stretching of the C8 and the T1. Okay, so what you will find here, there is a wasting of the small small muscles of the hand. This is called your clumpy palsy. Okay, usually damage of the C8 and T1. Usually when happen, there is a breach. एक तो common है breach delivery. This is very common. Also, if there is a trauma, suppose if एक बड़े बच्चे का हुआ, तो there is some injury or there is a football injury, anything के, or it is usually also seen in this if there is a cervical rib. Okay, so most commonly nerve जो involved होता है, we know that the nerve root of C881, C81 is an ulnar nerve. Okay, so Klumpig's में palsy में which nerve is affected? That is your ulnar nerve. So here what happened? This looks like a claw-like hand and usually severe atrophy of this muscles of the hand. Okay, so intrinsic hand muscles mainly are affected. Okay. So along with this, there are other symptoms associated with that of the claw hand. Depend करता है, but mainly याद रखना, Erb's palsy में C5 and C6, difference of clumpy is your C8 and T1. एक में weighted stiff deformative in the Erb's palsy, whereas में clumpy में claw hand like a posture. ठीक है? In here in Erb's palsy, basically which is affected, basically shoulder. So muscles of the shoulder is affected. The shoulder and the arm is affected, whereas in the claw hand, there is small hand muscles is affected. These are only the differentiative point for the Klumpig's palsy and the Erb's paralysis. ठीक है? So yeah, C8 and T1. Common upward traction of the arm or during the delivery. ठीक है? Muscles affected, intrinsic muscles of the hand.
स्लाइड पे, previous slide में.
ये वाला? Okay.
Yes.
So now intrinsic muscle, that is small muscles of the hand. Clinical features will be claw hand, weak grip strength, weak finger abductions, and sensory loss of the medial forearm and the hand. Okay, they're basically ulnar nerve distribution. Okay, got it? So this is all about your clumsy palsy. So हो गया? इतना याद रखना, one liner C8 T1 deformity, claw hand. Sometimes it is also associated with the Horner syndrome. Horner syndrome में याद रखना, you can get the practice of medicine के books में ये आता है question से. What are the clinical features of the Horner syndrome? Okay. So these are the basically differentiating point. You can just click it. Okay. Yeah. do this one. Full है. So tip of the injury, common cause, position of the limbs, movement, okay, and yeah. So ठीक है, you can click this one. तो आपको लिए easy होगा इसको याद रखने में. Okay. Now let's move to the wing scapula. Okay. इसको बॉक्सर पाल्सी भी बोलते हैं, स्विमर्स पाल्सी भी बोलते हैं. ओके, C5, C6, C7 affected. ये सब दे basically which nerve is affected? Long thoracic nerve. Okay, and you will see the scapula become more prominent. Okay, so this is called as winging of the scapula. They can come in the winging of the scapula. Which nerve is affected? Your answer will be long thoracic nerve. Okay, and here you will see the scapula become more prominent. Which nerve? C5, C6, C7. This nerve supplied your the serratus anterior muscles. Okay, and your scapula becomes more prominent, especially if you see the medial border. Now this medial border become more positive, more prominent. Okay, yeah. So what do you mean by the pulled elbow? So if you see the pulled elbow is also known as your nurse made elbow and radial head sublux, strip torn ligament or the subluxation of the radial head. Okay, usually seen in the children. The arm is held slightly flexed and then pronated. Diagnosis by the X-ray. Okay, so pulled elbow is your subluxation of the radial head. Okay, so what is this? Basically subluxation of the radial head, usually most commonly occur in the children of 1 to 5 years. That is your toddlers, especially in the toddlers. Okay, these are some of the common features. Now tennis elbow and the golfer's elbow. Now tennis elbow means basically inflammation of the lateral epicondyle tennis elbow, and there is an inflammation of the medial epicondyle. Okay, so this is only too important. They ask you the differentiating pointing between the tennis elbow and the golfer's elbow. Okay, so ये याद रखो, one is lateral epicondylis, pain outside the elbow, and one is your pain in the medial epicondyle, pain inside the elbow. So these are the only important clinical features. And some of this lateral side of the pain, lateral epicondyle of the humerus, middle epicondyle of the humerus. Muscles involved are the extension muscles. Here the flexors and the pronator muscles are involved. Common involvement in the tennis elbow is wrist extension against the resistance. Golfer elbow is wrist flexion is difficult. Okay, radiation of the pain along the lateral forearm, along the medial forearm. Nerve related, tennis elbow radial nerve irritation occasionally, ulnar nerve irritation occasionally. So these are the differential pointing of the tennis elbow and the golfer's elbow. Okay, so ये याद रख लो, axillary nerve, dislocation of the shoulder, deltoid paralysis, radial nerve, fracture of the shaft of the humerus, median nerve, supracondylar fracture of the humerus, ulnar, claw hand, sciatic nerve, posterior dislocation of the hip, foot drop, very important. Common peroneal nerve is also resulting into the foot drop, usually seen in the fracture in the neck of the fibula. Khatam? Let's see in the next part. Volkmann's contracture, sign and symptoms. Okay. So if you see that, commonly seen in where? Supracondylar fracture of the humerus. Okay. So this is basically about a type of the flexion deformity. Okay, usually affect the wrist and the finger. Usually seen in where? Commonly in the supracondylar fracture of the humerus. Here, as a result of the fracture, blood supply become less. There is an occlusion of the brachial artery and the anterior osseous artery. Okay, this artery supply the flexures of this forearm. Okay, so there is an ischemic changes in the flexure pollicis longus and the flexure digitorum profundus. Okay, so these are the important. Okay, so sometimes they can ask what are the flexors muscles affected. So ये याद रखना flexure deep flex dives. These are the mnemonic for this. Okay, what are the flexion muscles? These are the flexion muscles involved in the Volcomix contracture. Why it is happened? Due to the fracture in the neck of the humerus. Okay. And there is a decrease in the blood supply. So whenever there is a decrease in the blood supply, loss of blood supply, anterior muscles, forearm of this affected, the wrist and the arm become flexed, and the clinical feature of the compartment syndrome. So these are the clinical features: severe pain, pain when forearm squeezed, pain not improve with the rest, continue to get worse over the time. Okay. So, and what are the clinical tests? The stretch pain test. So when you try to stretch, there is a pain. Okay. Nerve involved, there is a nerve involved will be the, most commonly the nerve involved is the median nerve. Okay. A median and the ulnar nerve, both are, because claw hand is there. So your claw hand is, that is ulnar nerve is affected. Also the median nerve. Okay. So thenar muscles, median nerve supply the thenar muscles. So there is a muscles atrophy of the thenar muscles and also the ulnar muscles. So both the median and the ulnar nerve are affected. Okay. So this is known as your Volkmann's contracture. Remember this one, all the mnemonic also. Okay. So let's move to the next part of cast. Compartment syndrome ho gaya. These are the clinical feature of the compartment syndrome. Arterial injury, which artery? Brachial artery, anterior osseous artery. Common cause supracondylar fracture of the humerus. Another one you can say the tight plasters or the bandage. Okay. So trigger point may be also the tight fracture and the Bombay. So median nerve and the ulnar nerve is most common. The median nerve and the ulnar nerve is also involved. Okay. So these are the Volkmann's contracture. Now come to this decubitant synovitis. So decubitant synovitis, basically what is happened, there is an inflammation of the tendon sheath in the wrist. Okay. Yes, sir. So this is anatomical snuff box. Important आता है anatomical snuff box की boundary क्या है, ठीक है? So basically this two two tendons are affected: abductor pollicis longus and the extension pollicis brevis. Okay. So there is a rupture of the extension pollicis longus and also the seen, and these are also so decubitant synovitis. It is seen in the pollis fracture and the rheumatoid arthritis. So this is affected, and these two tendons are affected. Always main pain and tenderness over the patient may complain of pain and tenderness in the radial styloid. Okay. So usually seen in the mothers who are holding the newborn babies. Okay, so that is also known as your mummy's thumb. Okay, repetitive strain injury resulting in the pain in the radial side of the wrist. So pain in the radial side of the wrist. So usually seen the also known as a mummy thumb. Why? Because usually seen the new parents who repeatedly lifting the newborn babies, and also the person who are more in the writing, suppose texting, ठीक है, अगर too much texting भी करते हैं, that is one of the trigger factor. Lifting baby, okay, using the too much movement of the hand. So also there is an washerwoman's thumb. Okay, washerwoman's thumb. Okay, so these are the clinical feature of the decubitant tensinovitis. Okay, so some of the clinical features. And yeah, which test is used? This is known as your Finkelton test. You should place the thumb in this, and when you try to tilt it down, you will feel the pain here. So this test is positive in the decubitant tensinovitis. ठीक है? So this is all about. थोड़ा सा बाकी है. We will do in the next class. ये तो बहुत ज़्यादा हो जाएगा. Okay? Anybody have any questions? थोड़ा देख लेते हैं और 10 मिनट. ट्रिगर फिंगर बना लेते हैं. और कितना बाकी है? आई थिंक बहुत बाकी है एक्चुअली. हैमर्स तो फ्रैक्चर्स. सो अभी इतना तक करते हैं. नेक्स्ट क्लास में फ्रैक्चर्स करेंगे. ठीक है. सो ट्रिगर फिंगर में क्या होता है? इट इज ऑल्सो नोन एज योर स्टीनोसाइजिंग टेंसाइनोवाइटिस. ओके. So basically these are the tendons. Okay, there is a formation of the nodules in the tendon. Most commonly A1 pulley of the index finger is affected. ठीक है. तो टेंडन में swelling होगा, टेंडन में ट्यूमर बन जाएगा. The tendons become thick or the swollen and it cannot glide smoothly. So when the patient is trying to suppose this, look in the 1 minute. 1 minute. Yeah. So like in this, suppose I have this finger. Most commonly this finger is affected. Okay, the patient when try to bend the finger, एक तो finger पूरा bend होता नहीं है, and when they try to pull it up, they form a click sound. Okay, a click sound. This is called your what to say? This is because of this nodule formation here. Okay, so when they try to click it up, this node यहाँ से जो pulley है ना, that's tendon, the pulley, they try to come up from the here, but because of this nodule formation it is difficult. Okay, and that try resulting into a click formation, a click sound. Okay, so this is known as your trigger finger. Okay, now let's move to the next part. So yeah, the first annular pulley is affected, that is the A1 metacarpophalangeal joint, A1 pulley. These are the risk factors. 40s and 50s, women are more common, people with the diabetes. Now, mallet finger is what? There is an injury of the thin tendon that straightens the end of the joint. So basically, the distal interphalangeal joint in the finger is affected, and the interphalangeal joint of the thumb is affected. DIP and the interphalangeal joint. Okay, so mallet finger. अभी इतना तक ही रखते हैं because ज़्यादा I can't stretch. Anybody have any questions? Next जैसे हम लोग फ्रैक्चर खत्म कर देंगे, आधा घंटा लगेगा, and then we will start the gynae. Okay, gynecology आपका complete नहीं हुआ तो I will take the gynecology only. So anybody have any questions or have any slide left? So I will wind it up for today. किसी को कुछ भी पूछना है? So shall we wind the class for today's? Do you have any class after this? कोई class है इसके बाद? Okay, you can have this my number. I have a group. ठीक है? Just tell me hi. 798078476662. This is Dr. Sharoj. Just send me message. I will add you in that group. ठीक है? कुछ भी अगर किसी को क्वेश्चन पूछना है ना, you can directly add in that so that other people also can see the.
मैम ग्रुप में कैसे ऐड होंगी मैम?
कौन सा?
मैम आपके ग्रुप में मैम.
ग्रुप में?
मैम नंबर चाहिए मैम आपका.
नंबर मैंने दे दिया है ना, देखो आपको मिल गया है. ठीक है? 8479807662. ठीक है?
ठीक है मैम.
ओके, चलो देन लास्ट हम लोग फ्रैक्चर्स बाकी हैं, नेक्स्ट क्लास में खत्म कर देंगे और फिर गायनी शुरू हो जाएगा आपका. ठीक है? सो गायनी मैं ही लूंगी, आई विल टेक द गायनी क्लास। आपका आई थिंक एनाटॉमी और फिजियोलॉजी हो गया होगा गायनी का, तो उसके बाद गायनी का ही मैं ही पढ़ाऊंगी, ठीक है। एंड टेल मी इफ यू हैव एनी क्वेश्चंस रिगार्डिंग द ऑर्थोपेडिक, यू कैन टेल मी इन माय व्हाट्सएप मैसेज बॉक्स, ठीक है। सो थैंक यू एवरीवन।
मैम ENT
ENT कोई दूसरा कोई पढ़ाएगा, ठीक है। सो तुम ताहा से पूछ लेना, डॉक्टर ताहा या डॉक्टर नाजरा से, उनसे पूछ लेना ENT का कौन है करके। मैं आपका गायनी थोड़ा बहुत जो बचा हुआ है ना वही कंप्लीट करूंगी, ठीक है। चलो देन, थैंक यू एवरीवन, लेट मी नो हाउ इज द क्लास है, आई एम गोइंग टू फास्ट, मुझे रोक देना कभी भी, ठीक है। So thank you everyone. So bye, and next class आपका Saturday या तो Sunday होगा, not this week, from the January. Okay, so thank you.